Welcome back. This is episode 6, and today we're diving into the next chapter. Let's get started. Chapter 6, The Shaping of Character. It should be clear by now that birth is one of the most profound experiences we undergo. The games we play as children, the entertainment we enjoy as adults, even our sexual interests are, in one way or another, birth-related. To take one small but very common example, why does a child spend hours rocking gently back and forth on a playground swing? Swinging is not a game or a skill he is taught by parents or teachers. Children are drawn to swings instinctively because swinging reproduces the gentle, swaying motion of the womb. The adult who thrills at the magician's ability to pull a rabbit from a hat is responding to the same impulse. The rabbit's mysterious appearance from nowhere reminds him unconsciously of his own birth. This symbolic recreation of man's magical emergence from the womb is why magic has always had such a powerful tug on the human imagination. Many of our little idiosyncrasies can also be explained in terms of birth. We all know people who, no matter how nasty the weather, won't wear hats, turtleneck sweaters, scarves, or other restricting clothing around their necks. While this behavior is usually shrugged off as quirky by their friends, I think its origins lie in tumultuous birth experiences. Most infants present frontally, which means the greatest battering during birth. It is not hard to understand how someone who has had a particularly painful delivery might develop an aversion to head and neck wear later. These kinds of long-term influences are what I had in mind earlier when I said that part of us always looks out at the world through the eyes of the newborn we once were. Birth and prenatal experiences form the foundations of human personality. Everything we become or hope to become, our relationships with ourselves, our parents, our friends, all are influenced by what happens to us in these two critical periods. Having examined how uterine experiences shape us, now I'd like to explore how birth does. The long-term influence of early birth memories emerges very clearly in the second part of the study I conducted among my patients. It shows indirectly that if we are happier or sadder, angrier or more depressed than other people, it is, at least in part, a result of the way we were born. Although very few specific correlations between birth itself and such feelings as anger and depression emerged, most of the links were with sexual attitudes. Our sexual tastes say a great deal about us generally. A strong ego and high self-esteem, for instance, are almost invariably associated with healthy sexual preferences, while a battered or fragile ego and self-loathing are equally likely to produce strong, sometimes dangerous sexual predilections. A good example of this is the link the study found between induced labor and sexual perversion. A person who gets sexual delight out of tormenting their partner in an unbalanced way. Generally, this was confirmed by the fact that induced labor not only correlated with sexual sadism, but also with a masochistic personality. In this kind of birth, labor is brought on by a chemical derivative of oxytocin, which is fed intravenously into the mother. This causes her uterus to contract and eventually push the baby out. However, if the synthetic oxytocin is stopped, the contractions often stop as well, and the labor can be a very long and frustrating ordeal. Many women who have experienced an induced birth, and it is important to point out that most induced labor is performed at the obstetrician's suggestion or insistence, describe the experience as something that is done to them. They feel that the contractions do not originate inside themselves, but that they are imposed on them from the outside. As a result, they lose control of their bodies, and it is much more difficult for them to push in rhythm with their contractions. The mother is not in harmony with her body, and she is not in harmony with the baby at all. The baby, who is not ready to be born, is thrust out of the uterus by contractions, but gets very little help from the mother if she cannot push during her contractions, or if she is pushing between contractions. Also, because the mother cannot push as effectively, and because induced labors tend to be longer than spontaneous labors, the baby is often eventually pulled out by forceps. This type of birth is most unsatisfying for both mother and child. Labor has been imposed upon both of them. Neither was physiologically ready. They were not able to work together in the birth process. And my findings seem to support the view that this lack of harmony during birth can delay or impede later mother-child bonding and affect the baby's personality development. Induced labor is also a bad idea because it is physically dangerous. Every fetus reacts differently to it, says Dr. Edward Bowe, Director of Clinical Obstetrics at Columbia Presbyterian Medical Center in New York, and a leading expert on synthetic forms of oxytocin commonly used to induce labor. You can't predict who's going to take off and do well and who is going to have titanic, prolonged contractions, during which time the fetus may suffer brain damage or possibly even die from a lack of oxygen. The dangers Dr. Bowe describes may explain why the people in the study whose births had been induced also had a higher rate of delivery problems, and that put them at double jeopardy, since measured independently, a difficult delivery, for whatever reason, carries its own particular emotional, physical, and sexual risks. Many mothers experience strong sexual feelings during birth, and many of their children also have moments of intense pleasure as they pass down the birth canal. This is the child's first physical contact. Remember, he has been submerged in a protective pool of amniotic fluid for the past 9 months, and it leaves an indelible impression on him. Now, suddenly, his entire body is being squeezed and rubbed. His skin is being directly stimulated for the very first time. Together with this stimulation, he is also experiencing pain. The uterine contractions exert a great deal of pressure on his body, especially on his head, neck, and shoulders. This combination of pain and pleasure leaves a lasting mark on his sexual inclinations. Generally speaking, the more pleasure the baby experiences during birth, the more likely he is to develop normal sexual attitudes later. If the data from my study are a reliable guide, and I believe they are, birth experiences play a vital role in shaping sexual inclinations. The mutual stroking, hugging, kissing, whispers, and murmurs common to adult sex have many parallels in birth and subsequent bonding behavior. Cesareans are a case in point. The caressing and massaging the baby receives as it passes down the birth canal represent a first encounter with sensuality, and, however diffuse or unfocused, the quality of that feeling leaves a permanent mark. It is, in a very real sense, a forerunner of adult sexuality. So, in a different way, is the total absence of it. That is why cesareans often have sharply different sexual and even physical attitudes. Surgical delivery deprives a child of the physical and psychological pleasures a vaginally born infant experiences. Removed from his mother's uterus in an operating room, he gets no massaging or caressing. The feelings birth stirs in him often sound a discordant note. Physically, the cesarean has trouble with the concept of space. Knowledge of his body proportions does not come naturally to him. He does not seem to know where he begins or ends physically. So he is prone to be clumsy. Sexually, the effects are manifested in a hunger for body contact. The cesarean demands indeed requires continual stroking and hugging. Given the way he was born, it is not hard to see where his cuddle hunger comes from. Pain is the second vital element in all births. Intermingled with pleasure, it creates a sharp contrast for the infant. Nothing in his experiences has prepared him for the pain and anxiety he endures as he is shoved down the birth canal. Despite the magical interludes of pleasure, he feels under active assault. The legacy of this journey, with its bewildering and harrowing contrasts, leaves a profound mark on all of us. Our most enduring cultural and religious symbols reflect that influence. Both the distinctions between heaven and hell and the expulsion of Adam and Eve from the garden can be read as birth parables, and so can many of our most powerful myths. How we are born may even influence how we die. There is a remarkable similarity in the accounts of people who have been clinically dead for a brief period. Scientist-author Carl Sagan thinks this resemblance may actually be a reflection of the commonality of the birth experience. Sexually, these contrasts leave a mark in the form of ambivalence. Men express this ambivalence differently than women, and some of us feel the ambivalence more acutely than others, since the ratio of pain to pleasure in the birth balance varies from one person to the next. At its root lies a subconscious desire to re-experience the joy and tranquility, the safe place we once possessed in the womb. In men, this longing often expresses itself in mindless promiscuity, Endless sexual conquests are really veiled attempts to re-enter and recapture the serenity of the womb. But since by its nature this is an unrealizable goal, inevitably each compulsively repeated sexual encounter ends in disappointment. Though superficially similar to promiscuity, in women the desire to enter the womb takes quite a different form: hugging and cuddling. Since both are usually available only as part of sex, many women, especially single ones, become promiscuous to get the holding they want. The intensity of this desire varies greatly, as the birth balance does. Some women do not feel it in any direct way. In others, the yearning to be held and gently rocked back and forth is almost palpable. Several years ago, one young woman described the desire to psychiatrist Mark Hollander as a kind of ache. It's not like an emotional longing for some person who isn't there. She said, it's a physical feeling. Dr. Hollander was interviewing her as part of a study on women and holding, and his results illustrate how deeply this need, and hence the influence of birth, runs. Of his 39 subjects, slightly more than half, 21, told him they had used sex to entice a man to hold them. Most of the women asked to be hugged first. The men, however, wanted sex, so to get one, the women had to agree to the other. A second, quite different study shows the lengths to which some women will go to satisfy their longing for holding. The subject of this report was illegitimate pregnancy. The question under study: why do certain women repeatedly become pregnant out of wedlock? The investigators expected to hear a lot of complex emotional reasons, but the one that kept turning up was the desire to be held. Of the 20 women interviewed, all of whom had 3 or more illegitimate pregnancies, 8 said sex was the price they willingly paid for being held. Most described intercourse itself as something merely to be tolerated. Anger is another birth legacy we all share. It is a widely accepted psychological principle that pain produces anger. And since even the best births involve pain, it is inevitable that all of us are left with a subconscious residue of primal anger. That is perfectly normal. A danger arises only when that rest becomes large and unexpressed. This may occur because of an unusually painful birth, but even a relatively normal delivery can produce fury in an infant if the pain confirms what he has already begun sensing in utero, that his mother is rejecting or ambivalent. That is what happened to Christina, who spurned her mother's breast. For her and infants like her, the profound experiences of delivery tip the birth balance toward pain. They often remain irreducibly furious and, lacking an acceptable outlet, very frequently turn the anger inward against themselves. A common psychological phenomenon, unexpressed anger accounts for a number of emotional problems, among them psychosomatic diseases such as ulcers and even more commonly depression. Though a host of factors, including physiological ones, may lie behind depression, primal anger often plays a central role. An example is a man I'll call Ian, whose case was reported at a recent American Psychiatric Association meeting. Ian was a severe chronic depressive. Under hypnosis, his doctor explained during a panel discussion, Ian said he felt as if he were being pushed up and down in an elevator, and that made him feel alternately angry and depressed. Analyzing the image later, both Ian and the doctor concluded that the rhythmic, pulsating movement of the elevator symbolized sexual intercourse. But Ian could take this no further, nor could he explain the alternating anger and depression he felt at the very thought of the hypnotic experience. At their next session, Ian came up with the answers. He was not sure why, he explained, but something in the elevator image, maybe the anger, connected with his mother. He had never gotten along with her, and thinking about the image and the emotion it produced, he began to suspect it was related to his feelings toward her. So he called and asked her on the spur of the moment if she had had sex with his father while she was carrying him. Yes, she replied after a brief hesitation. Right before you were born, she insisted that it hadn't been her fault. His father had come home drunk one night and had forced himself sexually on her. 3 hours later, she told Ian she went into labor. Listening to this story, Ian's psychiatrist said, I felt a little like Newton watching the apple drop. Everything suddenly fell into place. I think it would for even the most skeptical psychiatrist. Until the day he unraveled its origin, Ian had internalized his anger at his mother for her betrayal. which accounted for his deep and prolonged depression. We may still not understand all the ways such primal emotions as anger and ambivalence work themselves into childhood and adult psychiatric disorders. But once we open up the interconnections between birth-related primal feelings and later adult personality characteristics, more and more connections between them become apparent. I have noticed a correlation among my own patients, for instance, between eating disorders, including obesity, and birth and the events immediately following it. From the beginning, food acquires important psychological meanings for us. Some of us use it as a substitute for sex, some for love, and others to help keep frustrations in check. This process starts with the newborn. How often he is fed, the quality of his food, and the care with which he is fed all take on meanings that influence his attitude toward food later. For example, if a mother feels good about herself and her baby, and if she has joyful memories, conscious and unconscious, about her own early relationship with her mother, she will probably feel good about breastfeeding. As a result, her child is likely to develop a healthy, well-balanced attitude toward food. Breastfeeding itself does not miraculously produce this attitude. If it makes a woman feel uncomfortable, or if alcohol or cigarettes are contaminating her milk, the child is likely to form an altogether different impression. Learning he can trust neither the provider of his food nor its quality, he may come unconsciously to associate food with negative feelings, which, as an adult, may lead him to suffer from any of a variety of eating disturbances. An unnaturally abrupt severance of the food-mother bond may also cause problems later. Since food in the mind of the child has come to be associated with love, security, and tranquility, it represents to him a source of special emotional magic full of rich and nurturing connotations. When it abruptly vanishes because the mother is too ill or busy to continue feeding him, he is going to be visibly and profoundly distressed. He may spend the rest of his life trying to recapture that lost love with a knife and fork. This is not inevitable, of course, because no one incident, however important, shapes us irrevocably. As we move through life, we continue to change and grow. But events such as birth and weaning, which until now have been viewed as objective, physiological phenomena, produce definite and long-lasting effects on the personality of a child. We must learn how to make the most of these opportunities. Chapter 6 is now complete. That's it for today's episode. Stay tuned for the next one. Until then, take care and see you soon. Thank you.